29 million adults in the United States have diabetes. Type 2 diabetes is the most common kind. The cost of treating this condition and its consequences can be quite high. Thankfully, diabetes prevention lifestyle change programs, recognized by CDC through the National Diabetes Prevention Program, or National DPP, help reduce the risk of type 2 diabetes among people who have pre-diabetes or are at an increased risk for developing the disease. Many employers, insurers, and state health plans offer these programs as a covered benefit. How do you know if offering these programs will benefit your employees or covered lives? And how can you predict if such programs will be a cost-effective option for your organization? CDC's Diabetes Prevention Impact Toolkit can help. This online interactive toolkit projects the health benefits and economic costs of providing National DPP lifestyle change programs to a state's, employers, or insurer's population. Click on an icon or a tab at the top of the page to select your module. Each module has an input dashboard where you'll enter data, and a results dashboard where you'll see the projections of health benefits and economic costs associated with offering a National DPP lifestyle change program for your population. A help page has several documents to help you navigate the tool and understand the results generated. Throughout the Impact Toolkit, you'll find tool tips. Hover over these little eyes to find helpful explanations and definitions. For this tutorial, we'll pretend you're an employer. Most steps will be the same no matter which module you choose, but we'll note any differences as we go. On the Employer Input dashboard, you'll see two data inputs: population characteristics and risk group to participate in the program. For both the employer and insurer modules, these are the two minimum inputs required. For the state module, you'll select your state and a risk group to participate. For the employer and insurer modules, enter the number of employees covered. For age, sex, race or ethnicity, and body weight for your population, use the default values shown, which are based on national survey data, or change some or all of the values. You can also select population characteristics based on national, state, industry, or occupation averages. We'll select Assume Industry Average for population characteristics. Notice that the breakdowns disappear when you do that, and an additional field appears. For some assumptions, you'll need to make one more selection. Here we'll select Construction for industry type from the pull-down menu. Next, select a risk group to participate in the program. Use the tooltips to learn more about each group. For this example, we'll select Persons with Pre-Diabetes. At the bottom of this section, you can leave the annual probability of diabetes as the default value, unless you happen to have this information for your population. Now you have a choice to make. You can get quick baseline results by clicking on the green Get Results button. The Impact Toolkit will calculate results based on the two inputs we've discussed so far: default values for your population and cost and program effectiveness estimates obtained from the literature. Or, for customized results, using data that more closely reflect your own population and past program experience, click the blue Customize Further button to reveal more inputs. Enter as many data points as you have available. For this example, we'll enter data for program costs and productivity costs. Productivity costs are only found in the Employer module. Before you customize data inputs, it may be helpful to work through the data input checklist for your module to gather information. Consult other members of your organization as needed. You'll find the checklist on the Help page. When you've entered your data, click Get Results. The toolkit will take you to the results dashboard. In all modules, this dashboard displays 8 results. You'll also see a Selected Inputs panel on the left. It summarizes the values you entered, or default values if you did not enter custom data, for select inputs. Click on the plus sign for a data element to see details. Click the minus sign to close the details. Many of the data are based on the number of projected program participants, the first result on the dashboard. The figure titles note whether data are presented for projected participants as a group or for a single participant. Remember, if you're not sure what a result means, use the tooltip to get more information. For each figure, hover over a point or bar to reveal the exact data. Click on Show Data Table to reveal a table containing all data used in the figure and, in some cases, additional related data and footnotes. Close the data tables by clicking Hide Data Table. If you find that some of the results are not helpful, you can remove them from the results dashboard. Simply click the light gray X in the top right corner of the figure. If you change your mind about deleting figures, click the Restore Results button at the top right of the dashboard. You may save your results as an Excel spreadsheet or PDF. These files contain both the results and the inputs used to generate those results. It's important to note that the Impact Toolkit cannot save results once you close the site or modify your inputs. Let's say you want to change some of your inputs to see how results would change. Maybe you want to see the effect of a lower program cost on the net costs per participant. You can change this input in the Selected Inputs panel. Enter your new program cost and click the Modify button at the bottom of the panel. Then look at the net costs figure to see how it changed. The Selected Inputs panel contains the data elements for which users are most likely to have customized data. It does not contain every data input available. To see all inputs, go back to the Input dashboard. Click the link in the Selected Inputs panel or click the Modify Inputs button on the top right of the results dashboard. Once you're back on the Input dashboard, click the Customize Further button to change inputs. You can modify some or all of the inputs. Perhaps you want to see the impact of setting a maximum budget of $20,000, and you want to change the risk group from persons with prediabetes to persons with high-risk prediabetes. After you enter your new inputs, click Get Results and see how your results changed. Comparing results from one scenario to another can be hard if you're looking at more than 1 or 2 figures. To do a thorough comparison of results, there are 2 options. Save and download the results from the first scenario, then make changes to your input data and download the new results. And review the spreadsheet or PDF files side by side. Or compare scenarios side by side on the screen using 2 browser windows. For this option, copy the toolkit URL, open a second browser window, not a tab, and paste the URL to launch the Impact Toolkit there. Change inputs as desired, either in the Selected Inputs panel or Input dashboard, and get new results in the second window. Resize both windows to see the 2 results dashboards side by side. You may notice the dashboard formatting changes when you resize the windows. Now compare the various results. You can also download the results from both windows to save these data. To share results with others, you can simply email the Excel or PDF files, or walk through the tool during an in-person meeting. Additional tools for sharing the Impact Toolkit and its results are being added to the Help page. Take a look and see what's new. We hope this toolkit will help you make an informed decision about offering a National DPP lifestyle change program to your covered population.